Welcome to today's episode of Campus Health here on ATU TV with me, Maristella Sekle, where we give you health updates. Today we'll be talking about antibiotic resistance, and I have with me Mr. Rocky Teteji, who is a practicing physician assistant. Hello, Doc, you're welcome.
Thank you, Maristella.
It's nice having you today.
Yeah, it's always a pleasure to be here.
Okay, we are so privileged to have you. So let's get straight to the point. When we say antibiotic, what are they?
Okay, the term antibiotic is a word that is coined to mean agents that are used to treat bacterial infection. It's a subset of a general group of medicines that are called antimicrobials.
Okay.
Yeah, with the antimicrobials, we have four main groups of infections that I use antimicrobials to treat. As the antibiotics are used for bacteria, and antiviral agents are used for the viruses, and the parasites who have their own agents, and then the fungi as well.
Yeah. Okay. So today our focus is on antibiotics. Okay. So can you tell us what resistance is in antibiotics? So when we say antibiotic resistance, what is it?
Okay. So in a layman's term or in simple English, resistance is something that is able to withstand the pressure or effect of something. So when you say antibiotic resistance is occurs as a result of the bacteria that's supposed to be treated or that's supposed to be killed or inhibited by the
agent.
Yes, antibiotic is able to survive even in the presence of the antibiotic.
Wow.
So the antibiotic is no longer able to kill the bacteria that is supposed to kill or prevent the growth. So it's two ways. Either the antibiotic is going to kill the bacteria or it will prevent its growth. If it's not able to do that, then we say the bacteria has developed resistance against the antibiotic.
Okay, so it's like the organism or the bacteria has developed some kind of odeshi. Yes. It doesn't work anymore.
Yeah, so just in the form of, let's say, a simple fight, when your opponent hits you and the person didn't hit you hard to die, when you stand up with a higher strength, maybe you kill your opponent and then stay alive. So the antibiotic that is supposed to kill the bacteria, in the circumstances, the bacteria is able to develop features that is able to even overcome the antibiotic.
Wow.
So in that sense, the bacteria will multiply.
So meaning you'll be taking the medication, but you won't be getting well.
Because the bacteria is multiplying, even in the presence of the antibiotic.
Okay. So what are some of the factors or some of the things that lead to such a situation?
Okay. So a few of them are with us most of the times. Some is our attitude towards hygiene. So not washing our hands, not cleaning our substances or plates and things that we use for food preparation, and then naturally hand health, because everything that you handle with your hand will end up eventually in your mouth or something when you are going to eat.
Wow. So when you don't wash your hands too,
yes,
you can develop antibiotic resistance.
Yes, because
that's interesting.
Yes, because if you don't get an infection, resistance doesn't develop. So if you don't prevent it, that's when you get it in the first place.
Okay.
Yes, and then the other ways are when you get people demanding for antibiotic in the presence of cold or flu. So there are some people that will visit you in the consulting room and you diagnose common cold or flu for them. Then you tell them that this is a viral infection, it will go on its own, they should just hydrate themselves, take some immune boosters, and it will be well. But they'll still demand for antibiotics. That for me, if I don't take antibiotics, my flu doesn't go.
Wow.
Yeah, when you continually do that, you expose the organism, the antibiotic to resistance.
So it means that in natural sense, we are not supposed to be taking antibiotics when we have common cold.
Yes.
Wow.
Because about 90 to 95% of the times is a viral infection. So you are using the wrong agents to treat the wrong uh, the
Organism.
correct organism. In this case, it's a viral infection, and you are using a wrong agent, which
Wow.
is an antibiotic, to treat it.
Okay. But what would sometimes you go to the hospital and you are prescribed as a layperson, you don't even know. So you
Mm,
have cold and you come back home with some antibiotics.
yes.
What would you say
So
to that?
So that one is a different category of ways by which we can develop resistance. So that is overprescription or misuse of antibiotics.
Okay.
So there are some physicians that also prescribe antibiotics to treat cold, or prescribe antibiotics to treat parasitic or fungal infections. So in those situations, it's the clinician that is what
Causing
contributing
it.
to what antibiotic resistance. So in those instances, when you as a patient and you know that, oh, my symptoms are more of a viral infection, and the clinician is giving you
How am I
antibiotics.
supposed to know? I mean, I wasn't feeling well. I
Oh,
just came to the hospital and
mm,
the doctor, I mean, doctors know it all.
yes.
That's what we
So
believe. So when you give me something, I don't know whether it's right or wrong most of
yes.
the times.
So that is why every patient have the right to ask him for questions about their conditions. So if you come to my consulting room and your symptoms are suggestive that this is a viral infection, and I give you antibiotic, because I'm supposed to explain your condition to you to say that, okay, this is what you are suffering from, and mostly it's caused by viruses. So I shouldn't give you antibiotic in the first place.
Okay, so let me chip in. You know, sometimes people go to the drugstore and then they're like, I'm feeling headache, I'm having chills, and automatically I have malaria. So they go to buy anti-malarials to take. Is it not the same thing in cases of antibiotics?
Oh yes, that is also another way. In some jurisdiction, you cannot walk to a pharmacy and just get a drug, just
Okay.
like that. Certain drugs and let's say lock and key, without a prescription from an authorized prescriber, you'll not be able to buy it.
And
So
here lies the case. The prescriber has prescribed it, and I don't know whether
yes,
it's right or wrong. I'll still go and get it.
that one they're fine. You get it anyway. You get it anyway. But
Okay.
what I am saying is that we all owe the responsibility to make sure that the antibiotics we are using to prevent infection or to treat infection, we don't develop resistance to them. So you, Maristella, for instance, you can particularly develop a resistance to one antibiotic that maybe other people will not have resistance to that because of the way you've been using it, you've been abusing it. Okay. So if a prescriber has given you antibiotic for a antiviral for a viral infection, and you're also happy in taking it without asking the relevant questions, in the long run it's you that it will end up affecting, and your hospital stay will be longer than somebody who doesn't have that resistant bacteria.
Oh, okay.
You get it?
Okay. So we'll be going for a quick commercial break. When we get back, we'll delve more into antibiotic resistance. Stay tuned. Welcome back from that quick break. So, we've been talking about antibiotic resistance and some factors that cause resistance. And Doc mentioned that overprescription of antibiotics is one of the causes of antibiotic resistance. So, let's move back to Doc. So, Doc, you were telling us about some of the
Yeah.
factors. Do we have
Yes.
any
So
other?
there are more to it. In situations when antibiotics are used in livestock
Okay.
and then animal farms, for instance, some animal farm they use antibiotics to prevent certain infections in the animals and then their livestock. So if they are not used properly, the improper use of the antibiotics in those situations can also breed resistant organisms.
Wow.
Yes,
What's
that's
the relationship between the livestock taking the antibiotics and then a human being developing resistance?
yes. So there are some of the organisms that live in animals,
Okay.
and then when we eat the animals, they transfer the organisms to us, or when we have contact with them, it transfers the organisms to us. So if the antibiotics are being resistant, or the organisms they are resistant towards the antibiotic that is being used because the appropriate measures were not put in place before they were used, and the organism, let's say for instance, when you need, let's say, a bottle full of this antibiotic to kill an organism in a livestock, and you go and use half for that process, then that means what you are just enticing the bacteria to grow more, because it will just make the bacteria weak, but it won't kill it. Over time, the bacteria
I'm
will
not
gain.
cutting you short, but I just realized that sometimes when I go to the hospital, they give me medication. I take it for 2, 3 days. I'm beginning to feel well. Then I forget about it. What do you say?
That is also a misuse of what antibiotics.
Okay.
Yes. So let me finish the scenario. I will explain that.
Okay.
So if you use the small quantity, not the relevant dose of what the antibiotic to treat the bacteria, in that situation, the bacteria will develop resistance, and if it's transferred to humans, it will be difficult to treat.
Okay.
So whether humans or animals, you have to do the right thing. So in the case that you were asking, if you take the antibiotics for some time and then you feel okay and you stop, yes. In that situation too, every antimicrobial agent, in this case we are discussing antibiotic, so resistance, and the formation or in the testing of what antibiotics, there is a certain duration that you have to take for it to see the effect. So if you take 2-3 days and then you are getting better, yes, you get better, and then by the 7th day, for which is for most antibiotics, you'll be fine. But if you stop along the way, and that means what the organism that is almost about to die can
come back
to life, because you are not hitting it to the last end for it to die. So just like in our local settings, when they say when you kill a snake, you have to cut off the head. Yeah, so in this situation, you are taking the antibiotic 2-3 days, you are getting better, and you stop. You've not cut off the head of the bacteria, so it will come back stronger. And in this case, when you use that same antibiotic to treat that bacteria, you can't kill it.
It won't work.
It won't work.
So it means that for the period that you didn't complete the dose, if it comes back stronger. So it wouldn't succumb to that same antibiotic. Okay, so as we've gotten to know the factors that contribute to developing resistance, what are some things we can do, or some of the ways we can prevent ourselves from developing resistance?
Okay, so it's just flipping what the causes are to get what we can do to prevent it. So in the case of antibiotics resistance, when you want to do things to prevent it from happening, and that means you want to follow the regimen. Let's say when you are given antibiotic for 7 days, you are supposed to take the full course of treatment, not to do 2-3 days and stop. The other thing too is that don't demand for antibiotics when you have a common cold or cough, a flu, because in that sense you don't need it. And then the prescription right too, you have to get authorized prescribers to.
So if you're just tuning in, this is Campus Health here on ATU TV, and we've been discussing antibiotic resistance with physician assistant Rocky Teteji. So let's continue the discussion, Doc.
Yes, so as I said, the prescription rights has to be reserved in proper healthcare settings, where you get healthcare practitioners prescribing antibiotics for you before you use them. Yes, the other thing too is that in our hospital settings, we are supposed to take.
Okay, if I get that right, so you're trying to say that when we go to the pharmacist or the over the counter
without a prescription,
we are not supposed to get antibiotics.
Exactly.
So who then is responsible for this particular act you are talking about?
Yes. So we the prescribers are supposed to give the prescription, right? So if you're a pharmacist and then a patient comes to you without a prescription, you are supposed to turn the person away. Go and see the doctor. If the doctor say you need antibiotic, then you take prescription and come and buy
But
it.
it's a business the person is running.
I'll come there. So that comes the issue of what's a business and then what the people make out of their businesses. For instance, in our settings, we don't have uh, stringent rules or laws regulating the use of antibiotics. So people go to the pharmacies, and because they also need money, they will sell the antibiotics to them and then take their money without a prescription. In some jurisdictions, when these things happen, you'll be arrested as a pharmacist because you are contributing to what?
Resistance.
Antimicrobial resistance or antibiotic resistance.
So, are there some policies? Are there some policies in place to ensure that um, individuals don't acquire antibiotic indiscriminately, and also the pharmacists don't sell it out without a prescription? Do we have policies like that?
Policies in terms of regulation, that's in our part of the world is not well regulated.
Okay.
So, but in some places, you can't get antibiotics without a prescription. Even certain medications, you can't, getting high painkillers, you can't get them on the shelves without a prescription. Yes, in general, that is it with the prescription. So, if they are able to enforce the prescription right, which is with the clinicians giving you a prescription before you can get it, it will be a long way. It will help us in a long way to curb antibiotic resistance.
And I think not only the physicians giving you a prescription, the physicians knowing when and how to give the prescription, because
Yeah.
there are cases where you don't deserve to take the antibiotic, but then they prescribe it, and then some prescribe it and it's either under dose or above the dose.
I think I made mention of that when I was talking about the contribution factors.
Yes.
Yeah, so that's accurate. It's not. Yeah.
Okay.
It's
Thank you
accurate,
very much.
yeah.
So, what do you say to our viewers? What can we do differently from what we've been doing in the past?
Okay, so if you go to the hospital and you are given antibiotics, make sure you complete the full course. Don't share antibiotics with your friends or families because
Well, that's another interesting
yeah,
part. I can start taking the antibiotics, and then once I've
you
recovered,
get
I leave the rest. So someone says my head is aching me,
exactly. Oh,
then I'll like, oh, come for this
the
medication.
last
The
time.
doctor gave
Oh,
it to me the last time. So that's a very important
yes,
thing you've hit on.
exactly. So sharing of antibiotics is also a bad habit. We need to desist from that. And as I said, taking the full course of antibiotics
Okay.
and then taking them at the right intervals is also very key. We should not encourage requesting for antibiotics in the presence of viral infections and common
Common
flu and
cold.
cold. Yes. In situations where we have to keep our hand hygiene very effective, we need to do that to prevent the infection in the first place.
Okay.
Yeah.
It's been very insightful. I mean, I'm getting to learn a lot of things, and I believe my viewers out there have also learned something new and will do better. So I'll take your last words, and then we round up the show.
Okay. Before the discovery of antimicrobial agents, most of these infections were with us and they were taking lives for fun. Just 2019, 2020, 2021, we saw how the COVID ravaged a lot of life, and then most people lost their life through that agent alone. So, if we have an agent which is the antibiotic against a certain organism that we are using, we have to make sure that we protect it so that it can be effective for us for a very long time. If not, simple surgeries that we do will now tend to be giving us a bad outcome. Simple procedures that don't need antibiotics, when they get infected and you even give the antibiotic, it might not work. So it is our responsibility as clinicians and also as clients and patients in quotes to be able to adhere to the rules of antimicrobial prescription and resistance at large. So we have to also engage in the antimicrobial resistance week celebration.
Okay.
Yeah, as well,
So we
so
need to
that we
create
keep
more
awareness.
awareness
We
among
keep reminding
people.
ourselves of what we have to do, the roles we have to play in order to prevent antibiotic resistance.
Okay.
Thank you.
Thank you very much, PA Rocky Teteji, for joining us on this show and for enlightening us. And thank you, viewers, for watching. A special thanks to ATU Studios and everyone who joined us on this show. If you're just, this is Campus Health on ATU TV. See you same time next week. My name is Maristella Sekle.